Hi, you guys. Welcome back for our daily practice questions. It is day 65. And as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. Now, I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. And y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And just a quick reminder for those of you who are looking to enroll in the upcoming 5 week review course, there are still some spaces available. Class starts on April 21st and runs through May 30th. So if you're looking to join, you can click the link in the description of the video or reach out to me and we'll get you enrolled into class. All right, question number one. A 28-year-old woman presents to the clinic with a 2 day history of dysuria, increased frequency, and urgency of urination. She has no fever or chills and is otherwise healthy. On physical exam, she is afebrile and has mild tenderness over the suprapubic area. A urine dipstick test shows positive leukocytes and nitrites. What is the most appropriate first line antibiotic treatment for her uncomplicated UTI infection? Is it A, levofloxacin, B, nitrofurantoin, C, amoxicillin, or D, ceftriaxone? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the most appropriate first line antibiotic treatment for an uncomplicated UTI? Now remember, I always tell you if they're asking about a treatment, you need to look and see if they have provided you with a diagnosis. But this stem of the question tells you all of that, right? We're looking for a first line treatment for an uncomplicated UTI. But you want to run it back and make sure you're paying attention to key details to make sure that there's nothing that's saying like they're allergic to anything or any other factors that may warrant you eliminating certain medications as potential treatment options, right? So in this scenario, we don't see any of that. This is simply a 28-year-old female who came in with UTI like symptoms. She's not febrile. She does have some mild tenderness over her suprapubic area, which is common with some UTIs. The leukocytes, nitrites, all common for a positive UTI, right? So with this, you would go with our standard first line therapy treatment option, which is B, nitrofurantoin. Remember, like I was telling you on yesterday's video, that there's a few treatment options that are first line, but nitrofurantoin, aka macrobid, is that top of the top, the captain of the first line. So if there's no reason that you shouldn't give it, go with that first, okay? Question number two. A 24-year-old pregnant woman presents to the clinic with a 3 day history of burning with urination and increased frequency. She has no fever but reports mild lower abdominal discomfort. She is otherwise healthy with no prior history of UTIs. A urine dipstick shows positive leukocytes and nitrites. Which of the following antibiotics is considered the first line treatment for her UTI? Is it A, Cipro? Is it B, Bactrim? Is it C, amoxicillin? Or is it D, nitrofurantoin? Take a moment and tell me what you got, y'all. All right, so here, stem of the question states, which of the following antibiotics is considered the first line treatment for her UTI? All right, so again, we're looking for first line treatment for UTIs, right? So let's go into what is going on here. So this is a 24-year-old pregnant woman. So this changes the game, right? She's pregnant, so we got to move a little bit differently with our antibiotic management, right? Number one, we know we're not giving Bactrim to the pregnant woman. Sulfa medicines we try to avoid in the pregnant population, right? Um, so we want to keep this in mind that she's pregnant. She presents with a 3-day history of all the UTI symptoms. She doesn't have a fever. She does have some mild lower abdominal discomfort. She's otherwise healthy. Doesn't say anything about any allergies. Okay. So then we want to walk our way through this. So for a standard UTI, 3-day history of it, we're not going with Cipro. Cipro is one of the big guns, right? We don't need that for this. So we're down to either C or D, right? So although we can utilize nitrofurantoin, and nitrofurantoin is utilized with, I should say, it's not completely ruled out for pregnancy. It's more so ruled out in the third trimester. Uh, that it is saying not to give based off of guidelines. Here, it does not tell us what trimester she is, how many weeks, or anything. So you don't want to go with that just simply because we don't know what stage of pregnancy she's in. Now, amoxicillin, penicillins are considered safe for pregnant women, for the woman and the fetus throughout the entire pregnancy. So your best treatment option for UTI management in a pregnant patient will be amoxicillin. So unless they give you a reason that she cannot take that, we're going with this, okay? Amoxicillin. All right, and lastly, question number 3. A 45-year-old healthy male presents with a 5-day history of dysuria, frequency, and urgency. He has not experienced fever, chills, or flank pain. He reports no prior history of UTIs or chronic healthcare conditions, but does mention an allergy to macrobid. A urine dipstick reveals positive leukocytes and nitrites. What is the best treatment option for his UTI? And that should say complicated UTI. Is it A, levofloxacin? Is it B, Bactrim? Is it C, nitrofurantoin? Or is it D, amoxicillin? Take a moment to tell me what you got. All right, so similar question. What is the best treatment option for his uncomplicated UTI? And again, it should say complicated, or you can just say UTI for this scenario. Because remember, uncomplicated versus complicated, really, it does not change the medication that we use, it changes the duration of the medication. And since we're not focusing on the duration, don't even worry about that. Look at this question that says, what is the best treatment option for his UTI? Okay, so we have a 45-year-old male presents with a 5-day history of dysuria, frequency, and urgency. So, all the presentation for UTI. No fever, no prior history of it, but he does have an allergy to macrobid. All right, so that should tell you right now to eliminate C, because nitrofurantoin is macrobid, right? So we'll eliminate C. Now, which would be our best treatment option? B would be, we go with Bactrim. Actually, Bactrim is the top of those first line therapy options for men. Men typically actually have more resistance to macrobid. It's not as effective. So Bactrim is like that captain for the male UTI treatment option. So B is your best answer in this scenario. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number one at gmail.com. Everything that I do offer is linked in the bio of this channel, including my website. And as always, if you're looking to book any of my one-on-one sessions or custom packages or plans or my question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first to gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.